You've probably heard the phrase gut health thrown around a lot, but what does it actually mean? In this video, I'm breaking down what gut health is, what it's not, and why it's so much more than just no bloating. My name is Erin Harner, registered dietitian nutritionist, IBS, gut health, and SIBO coach, and let's get into it. Let me first define what gut health is, because that's kind of a misnomer. When we think about gut health, we often define it in terms of what it's not. So sometimes that's the easiest way to come up with a definition, what it isn't. So if you have good gut health or your gut is healthy, we're not going to see things like constipation or diarrhea or SIBO or gas or bloating or diagnoses of IBS or reflux or a lot of pain in the abdomen. Those are things that are caused by gut dysfunction, a lack of gut health. So when we think about what gut health is, we're thinking about digestion. So digestion runs all the way from your mouth, all the way through your digestive tract, all the way to your anus. So let me just go through the organs really quick. We start with our mouth. Food goes in your mouth, down your esophagus, into your stomach, into your small intestine where it weaves all the way through, and into your colon that goes up and over and down and out the rectum and the anus. So we have to first think about, okay, gut health is not symptoms. If your gut is working properly, we like to see smooth, soft bowel movements 1 to 3 times a day. So when clients come to me, that's really my goal. Smooth, soft bowel movements 1 to 3 times a day. If it's more, or we have a lot of runny stool, that would be diarrhea. Or if it's less than that, maybe you're having 2 bowel movements a week, that might be constipation. Oftentimes with constipation, we see the hard stools, the lumpy stools. Sometimes it involves straining. It becomes very hard to push out. And where gut health comes in, and this idea of having a healthy gut, and when we're thinking about a gut, we're thinking about the whole GI tract from mouth to anus, specifically the intestines, the large intestine and the small intestine. So we have the organs themselves and the function of the organs, and then we also have the microbiome. So the microbiome is about 4.5 pounds. We just stop for a second. 4.5 pounds of bacteria that live in your large intestine. We want the majority of them to be in your large intestine. So when we have dysfunction or imbalances in digestion or the microbiome, that's when we start to see issues with constipation and diarrhea. So those are just 2 facets, but there are lots of things that can contribute to this. There could be issues with motility. It could be food intolerances. It could be inflammation. It could be imbalances in those bacteria, that 4.5 pounds of bacteria we were just talking about. It could be an evacuation issue where pelvic floor physical therapists are really our go-to for evacuation challenges. It's a GI tract is made up of muscles, right? So we have to remember that if muscles aren't moving properly, we keep digging. I ask why. What's the underlying root cause? We're not just saying gut health is defined as an absence of symptoms. We're thinking about gut health as being the presence of health, a good balanced microbiome where digestion is working properly. Not too fast, not too slow, not too hard or lumpy, not too runny, smooth, soft bowel movements 1 to 3 times a day. So that's what I'm looking for. And when we take antibiotics or we do things to knock out our gut bacteria, that's a lot of bacteria to rebalance and repopulate and re-establish themselves in a healthy ratio in your gut. So when I think about the microbiome, we're thinking about commensal bacteria. So your commensals are the good guys. They're the ones that we want to be there. And sometimes we'll start with diarrhea. Sometimes when we have diarrhea or loose runny stools or urgency to run to the bathroom, sometimes we see this with anal incontinence. We can't hold it in. We're feline to the bathroom. Sometimes I'm looking for things like food intolerances or food triggers. It could be something like lactose intolerance. I'm thinking about inflammation. Why is down there so upset? What's driving the inflammation? And oftentimes that actually has to do with imbalances in that bacteria. If there's 4.5 pounds of bacteria in there, sometimes there's too many bad guys and not enough good guys. So rebalancing that is really, really key. Other times we see things like an overgrowth of bacteria in the small intestine. And that can really produce a lot of gas and a lot of bloating and a lot of distension and a lot of discomfort. All of those organs down there, the small intestine, the large intestine, they're all sitting inside that pelvic bowl. And if you have a lot of pressure in the small intestine or a lot of excess stool in the colon, it creates a lot of pressure, right, in all directions, which can create pain. But when I'm thinking about diarrhea, I'm specifically thinking about 2 main things. I'm thinking about imbalances in bacteria, or maybe there's some things in there that we don't want in there. Sometimes those could be bacteria, sometimes they could be parasites, sometimes they could be worms, which we don't see all that often and we don't like to see, but sometimes they're present and they can cause a lot of problems. The other thing I'm thinking about specifically is inflammation. What's causing inflammation? And those two are the key factors with diarrhea. Now, when we're thinking about constipation, I'm thinking about, okay, why is food moving so slowly through the GI tract? Why is stool getting stuck? So those would be related to motility, right? There's motility and there's evacuation. Motility is the movement of the stool or the food from mouth to anus. Evacuation is actually getting it out into the toilet. So constipation, oftentimes what we're seeing is too much water is getting reabsorbed because it's moving too slowly. And some of the common triggers there can be dehydration, lack of fiber, or not enough of the right kinds of fiber, or even some pelvic floor dysfunction. We have to stop at the symptoms, the constipation, the diarrhea, and we have to really take a step back and say, why? Somebody else might have 3 completely different reasons that it's there, and how we address them is totally different. So we can't just say constipation or diarrhea is the problem. We have to dig deeper and find out what's really going on. If you're not sure where to start with your own gut health, I have a quick and simple next step for you. Take my free gut clarity quiz. It is designed to help you identify your unique gut type and understand exactly what your symptoms are and what they're trying to tell you. You'll get a personalized result and your next best steps to start feeling better fast. So just click the link below and you'll get the results in under 2 minutes.